Okay, I think we'll get started. I'm sure that we'll have other people joining us in the next couple of minutes. But just to remind everybody about housekeeping, so please mute your line when you're not talking or contributing. It just helps with so there's not feedback on the sound system. And also, if you want to send any questions and comments, as always, through the chat box, those really help to aid our discussions and that. So please do put into the chat box, and also obviously feel free to unmute yourself and ask questions directly and contribute to the discussions as we go through the webinar. Okay, so welcome to our fourth webinar. I can't believe it's the fourth one already, and we've got an exciting agenda ahead today. Sarah, can I have the next slide, please? So first of all, we seem to be picking our weeks carefully in terms of last time we had our webinar and it was a Maternal Mental Health Awareness Week, and this week it's Mental Health Awareness Week. So really just to flag and to ask people to look out. There's lots going on social media and on TV and that at the moment this week. So some really good resources out there. And please pass on to colleagues and clients as well. Thank you. Next slide, please, Sarah. So just to run through the agenda, and firstly to remind everybody, particularly if it's your first time joining us, that the webinar is being recorded, so if anybody has any issues with that, please do get in touch with me directly afterwards. It's just recorded so that anybody who can't join today can watch it at a later date. I'm kicking off obviously with the introduction. For those of you who don't know me, I'm Liz Cullen, Head of Clinical Programme for Maternity and Perinatal Mental Health. And Jenny Walsh, who will be doing part of the webinar later, is our Perinatal Mental Health Clinical Lead for Hampshire and Thames Valley. We're doing a slightly different running order this morning. So we're going to start off with a speaker, and we're lucky enough to have Alain Gregoire with us this morning. He is the chair for the UK Maternal Medicine Mental Health Alliance, and he's going to give some reflections on perinatal mental health and COVID-19. We're then going to go back to our normal format of national and regional update from Jenny and myself. We're going to show the Maternity Voices Partnership feedback video that we had at the last webinar, and unfortunately our technology failed us, but fingers crossed that will work and we'll be able to watch the video this morning. It has worked in all our dry runs. And then we've got third sector speaker, Danny is going to speak on behalf of Pandas, and then we're going to move on to our collaboration session, and this week we're going to discuss restoration and recovery, thinking about we are still in the midst of COVID, but starting to plan in terms of getting our transformation programmes back on track post-COVID, and planning for that, how we're going to do that, and that's going to be an interactive session for us all to discuss together, and we've got a good tool to help aid those discussions. So without further ado, I'm going to introduce you to Alain, who's going to kick off our session. Thank you, Alain. Alain, are you on mute?
That's brilliant. That's a very good start. I'm not on mute anymore. It's a great pleasure to be here, and hello, everybody. Could I have my first slide? So I call this reflections because it's really just a few idle thoughts, frankly, and I'm no longer on the front line, so I think you've probably got a lot more to tell me about what's going on with COVID than I have to tell you. But Jenny asked me to come along and share with you some of what we've been trying to do in this very short period of time since the start of COVID at the Maternal Mental Health Alliance. Can I have my first slide? Are you able to put that up for me?
The negative impacts is up there. Alan, can you see that?
No, I've just got the agenda up in front of me now. Why is that? So here am I not using this very well, possibly.
We're seeing the negative impacts of COVID.
Okay, right. Oh yeah, here. Okay, so it suddenly appeared on my screen. I don't know why there's a delay.
Right.
Okay, that's great. Yeah, so just a few idle thoughts, really. I think these are fairly obvious things to everybody, but we at a national level need to try and take some of these into account and share these. Clearly, the thinking both in the media and at political levels and at strategic levels across health and other sectors has focused enormously on the actual virus itself. And although there has been some discussion of mental health and mental illness, this has been I think fairly superficial compared to the level of detail that the media and indeed politicians have gone into in relation to things like acute hospitals and Nightingale hospitals and green masks and so on. And I think, frankly, that's always the same. But interestingly, when you look at the impact of major natural disasters and including pandemics, historically, the greatest human impacts are generally those felt in the mental health sector and are long-term ones. So I think this has not been given the attention, not that it deserves, but that it requires. And we need all of us to do our very best to try and get that focus on mental health issues. And in particular in the area of perinatal, where we know that stress and anxiety has an impact not only on the individual adult who we're considering, and of course there are vast numbers of them, but also, as everybody knows on this call, an impact in the long term on the family and in particular on that developing child. And although we know this to a degree that it's kind of just part of our thinking, we must be aware that most people don't realize the impact on the child, including in pregnancy. So some data that's another feature of what's been going on is that we have very little data about what is happening. So a lot of what we know is anecdotal, or based on logical assumptions, and it's going to be some time before data comes through. And that is, as we see from government decision making, very difficult to apply careful evidence-based strategic planning on anecdote and very skimpy evidence. So what we have in terms of perinatally, I'm just quoting in my first bullet here, a survey that was done by Baby Buddy, not yet even published in any way, and obviously a somewhat selected sample in that it was a survey of users of the Baby Buddy app, but asking those users about their level of anxiety compared to what they would normally expect as a result of COVID. 60% of women said they were a lot more anxious. So this is not just a little bit more anxious, which was a category as well, and almost 100% responded positively to that. But 60% postnatally, 50% antenatally said they were a lot more anxious than they would normally expect to be. And this is kind of fairly obvious, but in a way doesn't reflect the kind of reassuring messages that have emerged about the physical impacts of the COVID virus on the fetus and on maternal health physically. So clearly it reflects all the other fears and huge numbers of demands placed particularly on parents, and not just parents of older children who have to do homeschooling, but the demands of parents of younger children who are locked in indoors with them, and all the other demands, which are too numerous to list, really. Excuse my throat. And in addition, very relevant to mental health at this time is the reduction in face-to-face and practical support from extended family and friends, and we often underestimate the importance of practical support that can be given by the physical presence of somebody. In the mental illness arena, so that's kind of mental health and the perinatal population. In the mental illness arena, there is anecdotal evidence across the UK of reduced presentation. So certainly in specialist services, we are hearing across the UK, both from services themselves and from women who access them or who would normally access them, that there are all sorts of barriers, both within themselves, so fears of going near professional contexts and hospitals or clinics, and of course the closure of clinics, and the challenges in face-to-face care and indeed in hospital-based care, and the assumption through the message that's been given out by politicians that we shouldn't be troubling the NHS, that the message really got through rather too strongly in the early days, and hence the campaign to try and get the message across that the NHS was open for business. But that was still very often qualified with, so if you need emergency or urgent care. And in mental illness, people have different ideas of what constitutes an emergency or urgency. So real challenges there, and a net effect of reduction in activity in many areas, although many areas are now saying that that's beginning to pick up. But there is a fear that we may get a tsunami of unmet needs resulting from this period. So we need to be prepared for that possibility. And there seems to be, certainly anecdotally, I've not yet seen any data on this, but anecdotally we're certainly hearing of increased duration of untreated severe illness, which is of course worrying, because that suggests an increase in risk and very poor outcomes. Staff redeployment, both in specialist services and across the pathway, is highly variable across the country. So we've heard of areas where, for example, we have some data with health visitors, for example. We've seen in some areas of the country redeployment of up to 50% of staff at the most acute phase of the crisis, and other areas with no redeployment whatsoever of health visitors from their essential health visiting roles. And similarly, we've seen a variety of redeployment experiences across other areas of the pathway and in specialist services. And very worryingly, although no hard data that I've seen as yet in the perinatal context, there seems anecdotally to be an increase in domestic violence, and that of course is very closely linked with the work we do in perinatal mental health. So some really worrying, largely anecdotal evidence that's emerging about the impact, not so much of the virus, but of our social, political, healthcare response to COVID. It's worth just bearing in mind in our thinking that as a whole, there is some evidence, both historically and indeed with COVID itself, that the negative impact in other areas of health, including mental health, can be greater than the impact of the virus itself. So we need to bear that in mind as professionals thinking both individually and strategically. We need to bear in mind that this isn't a simple equation of reducing the impact of the virus, but we need to think about reducing the impact of how we respond to the virus. My next slide. And there are, of course, some positive impacts, including in the perinatal context. So not always a good thing, but certainly we are hearing anecdotally that partners being more at home can be an increased source of support. Not always, as I say, but this can be an incredibly positive thing, both for the partners themselves, who may have a unique opportunity to forge relationships with the baby that otherwise they might not have, and obviously for the woman herself, having more support available from partners who are at home and who are supportive. So that despite distressing stories of variability and challenges in partners accessing or being present, for example, during labour, although that shouldn't have been a problem, it was in many places, and during antenatal care and scans and so on, the presence of partner at home. We've heard many very positive stories about that. Fewer demands from extended family, interestingly enough. So this is the kind of flip side of the coin to less practical and emotional face-to-face support from extended family, actually not having endless family calling. We're hearing a lot of mums and parents describing an opportunity to quietly develop their relationship with their baby. So there can be advantages to that. And we're hearing that also very loudly in experiences on maternity wards and clinics. And there are certainly, I think, long-term lessons there. And interestingly, anecdotally again, but hopefully data will emerge on this, we're hearing stories of more women choosing to breastfeed, which may be related to fewer visitors wandering around maternity wards, and women feeling they have a little bit more of a quiet space and time to develop their breastfeeding, despite challenges in the home setting with getting breastfeeding support and breastfeeding advice. Although, again, we're hearing anecdotally that can work extraordinarily well through more remote modalities of providing that advice and support. Interestingly, we're hearing a lot of mums, and this is through surveys done by our members and through our membership largely of the Alliance. We're hearing reports, very positive reports of NHS staff in contact with women in pregnancy and postnatally being sensitive, and some are reporting more sensitive to emotional issues, stresses, mental well-being, and to the challenges that women face in obtaining support from their own networks. So there may be a benefit in terms of raising awareness across the pathway beyond what it already was at on mental health and related issues. And then finally, we're hearing very strong messages, including in specialist services, but in other services as well, that we as an NHS, as clinicians and services, are learning ways of working that are very likely to have a long-term impact in increasing choice, increasing modalities of access, possibly therefore increasing efficiency, and these remote ways of working for some situations, for some women and families, for some staff, for some services, may improve access in the long term. So there are things that we need to take with us after this crisis into the new normal that actually could be a great benefit. I was, for example, hearing from a specialist service in the north of England saying that they'd always been somewhat hesitant about developing telephone and video work with patients, and they'd had such positive feedback from the work that they've been doing as a direct result of this crisis that they are all very committed now to doing a significant proportion of their work in this way long term. And that was kind of music to my ears, because certainly in our service in Hampshire, because we've been working for a long time under huge resource pressures historically, before the expansion of perinatal funding and so on, we developed ways of working like that many years ago, and found them in many situations to be very positive. So that was great to hear. Next slide, please. So in terms of the Maternal Mental Health Alliance, just to mention and give you some links. So from the campaigning point of view, first thing to say is we are absolutely still on message with the same campaigning targets of having comprehensive, equitable, specialist perinatal mental health services, community and inpatient, for the whole of the UK. That does not change, and that does not change irrespective of future economic issues. That is a priority for healthcare, and we are not abandoning that. But during this crisis, we've also issued a plea to plan, and I'll show you when we move on to the next slide what we mean by that. And we very specifically decided that with all the demands on everybody's thinking at the moment, that we would call this a plea, as have many other organisations and charities and professional bodies, in a kind of collaborative but poking sort of way, prodding sort of way, I think is a better term, put the needs of women at this time and their mental health at this time into people's thinking. And for the first time, the MMHA is not a public-facing organisation. We're a campaigning organisation, but all our members were saying to us that there was really a need for a single place for women and families to go to for advice and for links, because there was a flurry of different variable quality sources, resources for women. So we decided in response to that to put some pages together and some links. So do visit that. And I think it is a useful, well put together page for women looking after their mental health during this time, with lots and lots of links, so you can get to everything else that we've come across from that. And then we also have an ongoing survey of mums and dads, and please, if you're able to pass that on in any way to get mums and dads to complete it, it takes just a few minutes, and it will give us some data, much needed data, on women's experiences and partners' experiences. So there's the link for that. Next slide, please. And the plea to plan, actually, this looks a bit fancy, and yeah, we've got an acronym and so on, but actually it's kind of pretty obvious, really. We're saying perinatal mental health is just as important as it ever was, and actually in this context is particularly important if we want to avoid crucial harm to a really important group in our population, and if we want to avoid long-term harm into the next generation. And I won't go into it in detail. We've put it out there and in a kind of non-specific way. I'm running out of time, but I didn't want to go into this in any detail. Please do refer to it. If you're in any way putting forward the importance of perinatal, you can say that the Alliance and all its 100 members are calling on all decision makers to make sure that perinatal mental health is prioritised and taken into account at this time. Next slide, please. So our next steps, well, I've already said, existing campaign absolutely continues and stronger than ever because, of course, there are new risks from the economic recession to the amazing developments that have happened in England, and new risks in the other nations to the developments that were just about to start happening in terms of specialist services. So we do not want to see regression of those. And worryingly, the specialist services that seem to have been, and this is anecdotal, but seem to have been the hardest impacted with, for example, redeployment and restrictions, are the most newly created wave 2 services, who maybe aren't as appreciated locally as they would be after having bedded in and become known, and whose staff maybe aren't as confident about fighting for their continued full force. So that is slightly worrying. So we are going to campaign strongly for the developments to continue. We are preparing some targeted messages for the plea to plan, so to go to certain groups of decision makers and authorities, and those will be coming out soon to those bodies. Once we have the results of the survey I was talking about, so it hasn't closed yet, I think it's got another week to run, we'll be looking at the results of that. So that will be the largest survey done so far, the impact of COVID on parents. And we are starting to work with our members and others on a set of principles for perinatal mental health care in the new normal. Now, I can't remember if that's my last slide. I think it probably is. Yes, it is.
Okay.
And I've gone over time, so I always do this. I apologise.
Well, thank you so much, Alan. That's really captured things in a really sort of thought-provoking way, I think. And have you got time for questions? If people have got questions, okay. Has anybody got anything either in the chat box or that you want to ask Alan verbally before he has to leave us? Oh, quiet today.
Silence.
Hi.
Well, I apologise if all of that was, or if much of that was stuff that everybody knows already, but at least it gives you a little bit of context of what's going on nationally. But it's what's going on locally that's really critically important. And I know that you, as a group, are carrying on discussing these things.
There's a couple of things that have come up in the chat box, Alan.
Yeah.
Janet House from Buckinghamshire is saying, lovely to see and hear you. So just passing that on. And Jane Lynch from Frimley is saying, how will the results of the survey be shared?
Okay, we haven't decided that yet. It's in collaboration with Home Start and Best Beginnings, and it absolutely will be shared. And between the three of us as organisations, so the Alliance, Home Start and Best Beginnings, I'm very sure that you will hear about it. So as soon as we've analysed and had a think about the results and how best to deal with them, they will be shared across all sorts of media. And I'm very happy to send Jenny a kind of summary of that as well for circulation.
Brilliant.
It's Alison Wenzel here.
Hi.
There was one thing that struck me. You were saying about services and how actually it seemed in some areas it was rather quieter because of COVID. But one of the things I've noticed when I've had to go out to a maternity hospital is that actually where I was, it was incredibly busy. Social distancing was really difficult, if there really, and because of the having to split the wards up into hot wards and cold wards as well, it makes it more difficult to get in the people. And of course, the trouble is, if you're having a baby, and if you're in labour or you immediately have some needs, it can't wait. So that was putting, I thought, an immense strain on some of the maternity services.
Yeah, that's very interesting. And I suppose quieter, what I've been hearing is more in relation to fewer visitors wandering around. But yes, absolutely. I mean, the work of maternity care hasn't reduced, and as you describe, has in fact got much more complex and frantic in some ways.
And I think Shirley wants to ask a question. Shirley Shayler.
Hi, Alan. Thank you very much. I just wanted to say it's been really helpful to hear what you've said, so thank you for that. It's especially helpful it's reassuring to hear your anecdotal evidence and how that's mirroring certainly the anecdotal evidence that we are seeing in Dorset. And I think it was really helpful to hear what you said about the importance for all of us in our roles, that while we may have a very good understanding of the impact, particularly on the infant and obviously the parents, that many of our colleagues don't. And I found that really helpful, because I don't know how others are finding it, but some of the comments I'm getting back from colleagues would want to focus much more on the good side of COVID. And while I recognise that, I think it's really helpful to hear what you've said this morning. So thank you.
That's very helpful to hear back. I mean, an example of where even at quite a high level, people were surprisingly ignorant was the RCOG guidance to employers on pregnant women and exposure to risk of COVID was entirely based on the risk of the virus to the fetus and the mother, which they concluded was there's no evidence of serious risk. Now, there may be unknown risks in the long term, but no consideration of the anxiety provoked by women, which is hugely increased in that workforce, and the impact of that anxiety on the mother and on the baby, and complete ignorance amongst occupational health doctors. So we've been in discussion with occupational health doctors and with the RCOG to ensure that that knowledge is put into the guidance. And the RCOG have responded very quickly, saying, adjusting the guidance, saying employers have a responsibility to the mental health of women in pregnancy as well as their physical health, and need to take that into account in pregnant women working on the front line. But as yet, still no explanation that is because there's a big risk from poor mental health and exposure to the anxiety as well as exposure to the virus. So these subtleties need to be explained to people, even people who really ought to know better.
Yeah, thank you.
Okay, well, lots of positives in the chat box, Alan. Thanking you, and lots of names that you all know. So yeah, I think that was very well received. So thank you very much indeed. And I know that you
chat to you all, even if I
very
can't
busy
see
and
you
you've
all.
got to. Yeah. Well, it's lovely that you were able to do it. Thank you so much.
Okay, and I'm sorry I have to leave
well,
you.
we'll let you
I
go
have to
now
go to a board meeting. All the best.
Okay. See you soon. Bye. Okay. So we're now going to do our national and local update, and quite surprisingly, we don't have a lot to say from national this time, but there were two new things that were published last week around this incredibly important issue of BAME staff and the increased risks that we're finding out from COVID. So we did push the Royal College of Psychiatry one out to the distribution list as soon as it came in. That's the second one on the slide. And there's also the Royal College of Midwife guidance on there as well, and they'll both be added to our resources, which I'll talk about in a minute. And then just a reminder for everyone about the future collaboration platform, where a lot of these resources are also uploaded. Can I have the next slide, please? Thank you. So we have been collating resources for you. We realised that you have been bombarded with all sorts of resources, and some will be useful and some maybe not so much. And so what we're trying to do is to be a filter so that we can sort of sift through and find the most relevant, high quality, perinatal specific resources in relation to COVID. So this is just to show you how they're laid out. So what we're going to do today is show you the whole lot that we've gathered. We won't show this every time, but I just wanted you to get a sense of what we've got and the way we were doing it. So they're divided in two different sections, and the first one is the national bodies, because obviously a lot of our national bodies have been very prolific in getting out high quality information, and they're often like the go-tos for specific stuff. So we've put all that in one place. Next. This is just an example of one of them. I'm not going to go through every single one, but if you click on the link for the Institute of Health Visitors,
Can I just ask everybody to go on mute?
Don't know what that's about.
If anybody's just joined, can you go on mute so that Jenny doesn't have the feedback on the sound?
Lovely.
Thank you.
Brilliant, thanks. So this is just an example of one of them, and like I say, I'm not going to click on all the links, but this is the Institute of Health Visitors, who have an amazing new suite of parenting through COVID. So it's that sort of stuff, looking at all the wonderful perinatal resources that are out there. These are the COVID specific perinatal ones. Okay, next slide, please. Thank you. And then just to go through our list, so we put some in a group by topic, so diagnosis, for example. Then we've got the third sector websites, and particularly the helplines, because we thought under these sort of isolated that we're under, I thought it was really helpful to have all the helpline information in one place, because there's that real need of feeling a sense of connection, and there's so many really good helplines out there, so we've put them in one place, hopefully to help you to be able to direct some of your mums and dads to them. Next slide, please. Okay, and then we've been gathering the accessible information that, so things like, for example, if we take the doctors of the world, they've got coronavirus information translated into over 60 languages, and then all important staff wellbeing resources as well. Okay, the next one, please. And then we've got finally a section on new ways of working during COVID, because there's been some publications from the NHS around video, and also working virtually with babies. So we thought it would be quite helpful to have all of that gathered in one place. So the way they're going to play it from now on is that we will, instead of, can we just go back to the previous one and stay on resources just for a moment? Thank you. So the way we're going to play it is we won't show the whole list again, but we will show you the new resources that we've found on each webinar, so that you know what the updates are. You'll get this set with your slides today, and then it will be uploaded onto the Futures Collaboration platform. So that's where it will sit. And there are some things that we need from you. We need to know that this is helpful, because obviously it does take some resource to collate resources. So we need to know that we're spending our time in the most, the most useful manner. We need to know if we've got the sections right, and if there's anything else that you'd like to see. I'm sure over the next couple of weeks we'll probably be developing some domestic abuse section, as there's more material coming out around that. And we also need you to send over anything that you receive that you think would be helpful to go on here. So just keep it coming. It doesn't matter if we get it from 5 different sources, and then we can check it out. And we do check. We don't just chuck things on here. We're checking to make sure that the information is sort of high quality. So yeah, that's just the feedback that we need from you. Are they helpful? Have we got the sections right? Any other sections that you think we should be adding? And please send over any helpful resources that you've found in this period and this new way of working that you think other people could benefit from as well. Okay, does anybody have any questions for me on that before I hand over to Liz? No? Okay. Okay, then I'll hand back to Liz.
Thanks, Jenny. So it was really just to give a bit of a plug about the Royal Voluntary Service. So currently they have capacity and can offer support to our women. So they are able to offer support in terms of befriending, shopping, lifts to and from hospital appointments, and also deliveries of medication and resources. And at the moment they're reporting, as I say, that they've got underused capacity, but obviously as they're advertising that, I'm sure that will ramp up. So it was really to make you aware and to plug into that if you feel that would be useful. Can I have the next slide, please, Sarah? And if you click on this link, which obviously you'll have in your slides later, that takes you through to a direct referral form in order to complete it, in order to get support for a woman, but also women can refer directly themselves. So it's just to kind of make people aware that that resource is available to people. Thank you. Can I have the next slide, please? Okay, and then I also just wanted to highlight, and some of you may well have been on this webinar on Monday. So there was a national domestic violence webinar held on Monday lunchtime. I've attached the agenda, and for those of you that weren't able to join that resource, there was a recording of the webinar, and the email address is at the bottom of the slide for you to contact if you would like to have access to that. So please do, there were some good resources on there. And we will obviously keep you updated with further webinars as and when they are held nationally. For those of you who were on the webinar, just in terms of chat or please speak out, did you find it useful? I know that the national team are keen to get feedback on that, so please feel free to put anything in the chat box. Okay, next slide please, Sarah. So I'm going to hand over to Sarah, and this is just going to be a couple of slides going through the feedback that we asked you for from at the last webinar on the SurveyMonkey. Obviously these webinars are for your benefit, so your feedback is really key for us making sure that the content is relevant, that the frequency is appropriate and everything. So please do continue to give us your feedback, and I will hand over to Sarah to go through the data that we got back. Thanks, Sarah.
Yes, we just asked you after the last webinar to complete a very short SurveyMonkey. So there were only 4 questions. We had 11 responses, so it's not representative of everybody, but this is what the people who responded told us. So we asked about problems joining the call, and nobody who responded had problems, but I can see in the chat box today that people are having some problems, so that may be different when we ask you about today's webinar. And we also asked whether you preferred to interact with us verbally or by typing in the chat box, and it was slightly fewer verbally than in the chat box, but there is an option to use a different system where you wouldn't be able to communicate with us verbally, so we've concluded we'll carry on with this system at the moment, because there still seem to be a fair number of people who do want to talk to us, talk out loud, which is great because it makes a bit more of a conversation. So the other 2 questions were about what the most useful things for the webinar were, and so there was a mixture of updating information, networking, hearing about other people locally and nationally, and the service users being involved and being able to understand what's happening and be part of that discussion. There was also discussion about the domestic abuse, and that's the topic we're going to cover again next week. But there was something about connection and hearing about other people and how they were getting on. In terms of topics for future speakers, we'll work on these. There's some really helpful suggestions here, so we'll hopefully find somebody from the IHV and looking a bit about planning and preparing services, and I think we've sort of started a bit on that today with Alan's talk about the future needs. We're also going to talk about domestic violence and domestic abuse next time, so hopefully that will be helpful. A request for someone from the Anna Freud Centre, and also talking about managing non-engagement and supporting people with personality disorders and complex trauma, and how to help non-mental health professionals to help other women with increased mental ill health. So those are all things we'll look at, and if you've got suggestions of speakers, we're very happy to approach them. So do just let us know what's useful to you. So we'll probably send around another SurveyMonkey shortly, and it'd be really good to hear from as many people as possible about what you think, both good and bad. It's always helpful to know. Thank you. Technical difficulties have been sorted, and we're ready to go on to our talk from Pandas. So I'm very pleased to introduce you to to Danny Gillette, who is going to talk to us about Pandas offer during COVID. Thanks, Danny.
Hi, thank you. Unfortunately, I can't see the slides. There's no share on my screen for some reason. I don't know what keeps happening. So I've got the slides up on my computer. So I'll just go through the slides and hopefully you'll be able to follow when to move on next.
Yeah, just tell
Danny,
me.
Danny, if you just say when you move on, when you want the next slide, we'll do that for you our end.
Perfect, thanks very much. I'm Danny. I'm the support groups manager for Pandas. I'm also involved in my local MVP, and I've done quite a lot of changes and support through maternity services. I'm an adult nurse by background, so I've got my fingers in many pies. So who are Pandas? So that's our next slide, if we could please. So Pandas are the leading UK charity. We support individual parents, so mothers and fathers, and we also support their families as well. So the families can contact us with regards to a worry or wanting to support for their loved one who may be going through mental health services at the present. We do pre and postnatal mental illnesses. We do all of them. The only thing we haven't got much support around at the moment is loss. Unfortunately, that's something we're trying to develop in the process. So PTSD and loss of a parent is something we're growing our services on. But for the majority of the mental health services, we do find support for them, whether it's signposting or whether it's support through our own selves. So our next slide, please, which is our mission. So the mission for the charity at the moment is to be the most recognised and trusted support service for families suffering from prenatal and postnatal mental illnesses. We are one of the most recognised at the moment who actually have direct support for parents and their families. I think we've increased over, probably since COVID began, we've actually increased our awareness and of who we are, and the support that we give is actually increased as well, which I'll talk about in a little bit. So we are getting there, and as a charity we are nationwide. We go from Scotland down to the bottoms of England and through Wales, so we've got support all over the UK. The only place we don't have any support at the moment is Northern Ireland. So next slide, please, which is what we look like. So Pandas as a charity has many forms of support that we give people, and they are the face-to-face group support, which unfortunately aren't running at the moment. But we do have an alternative, which I'll discuss in a little while. We do have a free helpline, which is daily, 11 AM till 10 PM, and anybody can ring that who's either worried about their own mental health or they're worried about a family member's mental health. And they're trained volunteers that are on the end of the phone, a little bit like Samaritans, where we're there to talk to them, listen to their worries, signpost them where necessary. We do have safeguarding in place as well, where we have a safeguarding manager. So if somebody does ring us up in crisis, we have a way forward on how to make sure that the service user is safe when they call. And the same with the email support. You can email at any single point in time. We do ask for about a 72-hour response, but 9 times out of 10 you probably reply to within about 12 to 24 hours. But on busy, we are exceptionally busy at the minute, as you can imagine. So support and replies are a little bit longer due to that demand. But again, we have a safeguarding process in which we can follow if anybody contacts us in a crisis. We have a social media team and a PR team who work with the media, and they promote our awareness and our fundraising. We have multiple articles out at the moment in different localities. We've worked alongside Coronation Street with the mental health that's just gone through there. We worked quite closely with them with the perinatal mental health, and we provide training for all of our volunteers, and they also are trained in providing resources, support and signposting to those that need it. And we rely wholly on fundraising. We are a charity, so we do rely quite a bit on fundraising for that. So next slide, please. So during COVID, we've actually had quite an increase in things that have changed, and in the support that we provide We have changed the way that we do. So we were quite fluffy at the beginning, and we used to just put out positive notions, a few quotes of the day and things like that. So since going into the COVID era, we've kind of changed the kind of information that we put out there now. So rather than just putting happy thoughts and tips of the day and things like that, we now regularly update the service users with key information and relied upon resources, so from the RCOG and the NHS and things like that. So everything that we put out now is informative, it's useful, it can help, and it's from sources that we know are trusted and relied upon. So we give regular updates to our volunteers on the attitude and the legal duties. So we know that the pandemic has changed the fact that we can no longer run support groups, so we've changed the way that we do that. The manager themselves, we're all from all over the UK, so the way that us managers work, we're completely remote anyway, so we don't really have access to anyone, so the way that we work hasn't really changed. But I know for a lot of our volunteers, the groups that they ran, they were obviously very, very face to face, so the way that they've changed. And we do have quite a few that are midwives and other health professionals, so we know that Pandas has taken a little bit of a back seat for them, so that their service users are being sent more to our hub kind of helpline services, so that they can concentrate on their main job, which obviously in a time of need they are getting very busy at the minute. We've changed our social media policy and strategy, so we've put the motivational content, the resources, and some daily activities and things like that we've got out there. Like I said earlier, we worked quite a lot with the press, so we've got quite a few articles out at the moment that are trying to get us recognised, and help and support to say that we are there. We know that isolation's a big one. We know that domestic violence is a big one, so just having somebody to be able to speak to sometimes is a big thing. So we're trying to cover all areas really, and I think we've noticed that a lot of men are starting to come forward a lot more as well, especially because they're quite isolated as well. The worry for each other, so they're noticing more if they're at home, or the partners are noticing differences with their family member that they wouldn't normally recognise if they were out at work every day, for example. So that's the changes for our services, I think, from the way people are contacting us. For the first few weeks, we had about 75% increase in our calls, our emails and everything else. That has come down quite a bit at the moment. We're thinking that's just because of privacy. When you've got your children around, it's a lot harder to give us a ring and have that time to be able to chat without hearing the words mum, dad every 5 minutes or so. So we do think that's had a bit of an issue. We've had quite a large amount of following that's increased within our social media platforms, however. So, for example, our Instagram pages have had an increase of 1.5k followers. So where we've lost it in one, we've kind of gained it in another. So our social media is going really well in that respect. We've had 5 articles published between April and May, so there are press releases, and we've had a new COVID policy for the foundation as well. Just to follow that on with the next slide, to try and help with the helpline, with the fact that we knew that privacy was going to be a problem, we've actually changed the times of which we run our helpline now. It is a completely free number from all UK landlines and mobiles, and we now run from 11 till 10 p.m, whereas before we were 8 till 8. So we're trying to give that shift to the evening where children start to go to bed, partners start to relax elsewhere, and then people can start having that bit of privacy to try and call and chat to us. We've suspended all of our support services at the moment. We are looking at a strategy and a policy on how to bring that back once lockdown is lifted, and how social distances is going to be implied. So we are going to have a whole new policy and strategy with regards to our support groups when they come back in the future. As for now, we're doing them virtually. There are a few of them that are doing Zoom calls on the days that their groups would normally run. So they're running them the same, they're just just doing them virtually from people's own home. Some of that's been responded quite well, but there has been less attendees to those than there would be if they were attending the group. And again, I think that's around privacy and the time to actually to do the time to call and sit and chat. So social media has been our biggest one, really, where we've tried to put things out there to help people with the resources and hand it to them rather than having to search for it. We as managers have increased the support that we've provided for our volunteers. So even though we know that a lot of them have stepped back because of the NHS work has taken precedence, which is understandable, we're trying to give those the extra support as well, because we know that they're going through hard times and their stresses and things are increasing through this time. So the way that we do that is I personally do monthly Zoom calls with my group leaders, and the topics have usually been centered around something to do with pandas, whereas this month in particular it's just going to be a chat about how everybody is, how everybody's finding it, and if there's anything that we can do or anything that we can support them with at this time, then we're trying to, as managers, take onus of some of their supports, things that they're doing as well. So we've kind of stepped up on what we do with the social media platforms and things like that, just so that there's not as much pressure on the volunteers, just to help them, because obviously mental health is going to be an issue for everyone, and 90% of our volunteers, if they're not NHS professionals, midwives, health visitors and things, then most of them have had previous mental health difficulties themselves, which is why they've set up their groups and they're supporting parents. So we want to make sure that we don't then put them back into a position where their mental health suffers. So I do one-to-one phone calls as well with a lot of them, and every other day or so I tend to go onto the social media. We have a page of our own where I try and just say how you're doing, put a thank you up there, put a meme up there or a quote or something, just to let them know that we're always about. And at the moment, my role within Pandas has changed slightly, where I'm now doing training as well. So since I began in 2016, training's been something that I've been quite passionate about, because I did think that there was a little bit of changes that needed to be made within the training packages. So myself and another manager went down to London and we had the IHV Champions training with regards to perinatal and infant mental health. And I'm going to be disseminating that throughout the charity to hopefully give them a broader mind of what perinatal mental health is, how to help and signpost, and how to deal with people who are in crisis to make sure that everyone remains safe. So the training packages have picked up quite a lot, and that's been noticeable because there's been more people attending that have actually needed that support and that extra, and we've had quite a few safeguardings recently with crises and people like that. So hopefully with a bigger knowledge base, they'll be able to understand and deal with those situations better. So the next slide, please. So this is all about our fundraising. We do rely 100% on donations. We are not in any way supported by the government or the NHS. So everything we do is completely fundraising relied upon. We are all volunteers, so everybody who does the support groups, the phone lines, the social media, they're all volunteers and are giving their time to allow us to do that. We are the largest and most available support network nationwide, and we're the only perinatal mental health charity to have a helpline which is available free of charge for UK landlines and mobiles. We do support thousands of men and women nationwide, and we do have numerous ways in which we fundraise. So because the fundraising has kind of gone down a little bit at the moment with COVID, so people aren't able to do the runs, the picnics, the cake sales and things like that. We've tried to do a lot more online. So we've had raffles, we've had guess the name of the bear, and we've got wristbands and things like that. So we're trying to do it more virtually on the way that we fundraise, and that has been quite successful, luckily for us. So next slide, please. So all we're asking everybody to do is spread the awareness, support us, support the families that we support. So with regards to that, we have access to a lot of professionals within the mental health area, so whether it's the local mental health services, the local maternity services, specialist perinatal services, things like that. We do rely quite a bit on referrals from them, and we do regular chats and talks with them and meet up with them and work collaboratively together, so that parents can find the services without having to search for it too much. With everybody else, same as the Mental Health Alliance, we are trying to end the stigma, and we do a lot of awareness around the mental health and perinatal mental health, and it's okay to not be okay and things like that, and obviously to raise funds and continue to develop our services. So for our last slide, thank you very much for listening. I hope that was useful. On the slide, you'll have all the details of all the different things that you can contact us with. So please take a look. And are there any questions?
Thank you so much, Danny. That was so interesting. I think it's also very interesting the way that things morph these days, so that your Instagram and social media, has increased so dramatically. I think everything is changing so quickly at the moment.
Yeah, definitely.
So can I just ask the audience if anybody's got any questions for Danny? The joys of working from home in the background.
I know, I was just thinking that. Can you hear that?
Is that yours?
It is, yeah. The children are having fun with my husband downstairs.
Brilliant. Okay, well, they've all gone quiet on us, Danny, but thank you so much.
No problem. Thank you very much for having me.
Yeah, and I know that Pandas is a organisation that we all use. So thank you so much for coming along and showing us how you've adapted to these strange times that we're living in.
Not a problem at all. My email's at the very beginning of the slide, so if anybody does think of anything, you're more than welcome to give me an email and I can answer as best I can.
Lovely. Somebody's just said thank you, and it's good to know about the extended phone time. So yeah,
brilliant.
That's really helpful. Thank you.
Thank you.
Okay. So I'm just going to move on to our collaboration session, but realising that we have very, very little time for this. So what I wanted to talk about was the fact that under COVID, we've all changed the way that we work, and we've dropped some things, and we've introduced some new things, and we're all working a bit differently at the moment. So maybe today I'll just introduce you to this model, which you may find helpful. So this is a model that I was hoping we could have more of an interactive session with today, just thinking about each of these boxes. So if I'll just take you through it. So the first box that's called end just says we've done these things to respond to immediate demands, but they're specific to the crisis. Then underneath that is let go. We've been able to stop doing these things that were already or are now unfit for purpose. And you may well find that there's things in your practice that you have stopped, and you think, oh, actually, I don't know if we need to pick that up again. We're working quite well without that. Then top right corner is amplify. We've been able to try these new things, and they show signs of promise for the future. So I know that everyone's embraced different ways of working virtually, different team meetings. There's quite a lot of examples of new practice and new ways of working that people have found really useful to capture up there. And then bottom right is restart. We've had to stop these things to focus on the crisis, but they need to be picked up in some form. And I think we've all probably got a lot of examples of those from the implementation of the long-term plan through to maybe some of our more routine work that has been dropped to help us to cope with the crisis, but we really need to make sure that we don't forget about those things as more normal way of working comes back on stream. So we've literally got 5 minutes left, and I'm just wondering if anybody wants to sort of put anything in the chat box or talk to me about any of those things. I think we'll treat this as very much a first taste of thinking about restoration and recovery, and we'll revisit it again down the line in a subsequent webinar and give it a bit more time. But has anybody got any first thoughts today to of any of those categories, to see anything that's sort of springing to mind? I mean, I guess for me, I'm very mindful that we need to be not losing sight of the long-term plan, because a lot of the stuff that's in the long-term plan for perinatal mental health is actually also going to help us to pick up some of the increased referrals that are highly likely to come out of COVID. So maybe in terms of birth trauma, increased anxiety, some, you know, work around bereavement and loss. It's been a funny old time both to be born and to die, and I think we're going to feel resonance from that down the line. Yeah, so that would be mine in Restart, is very much about making sure that we pick up the long-term plan. And Nicola's just put in the chat box about picking it up at the next meeting, which we can do. We are going to focus on BAME next time. But we could have this next time if that's what people want, or yeah. But we definitely won't forget about it, and I think it's quite helpful to share the model with you. So I when I saw it, it just made sense for me and I thought, yeah, I'd really like to share that, because sometimes it feels like a massive mountain to climb, I think, and when you've got a model to sort of hang it on, and it might not work for everybody, but it's one that worked for me.
I'm just picking up, and I think who had said Shirley's beat me to it, so I was just going to say, what I think we'll do is it will obviously be on the slides, but we'll send it out separately as well on a spreadsheet. And so you can start to pre-populate it. If you're happy to send us back your comments, we will also collate some of those things so that we can present it at future webinars.
Yeah.
And then also, just to make you aware, so we will also be using this both regionally and also both for the perinatal mental health regional team, but also the maternity cell. So your input will feed into that as well. Debbie. Okay. Debbie Kennedy's got her hand up. Debbie, do you want to say something? Are you on mute, Debbie? Anything from you, Debbie? No? Okay, we'll move on then. Sorry, Jenny, back to you.
Okay. Was that our last slide, or was there one? There we go. That's just so just to remind you that they are fortnightly. The next one's on the 6th of June, when we'll be focusing on BAME. We've already got some great speakers lined up, both around our BAME workforce and also working with our BAME women and families. I'd like you to spread the word. We will be doing a piece of work around attendance, because it has dropped off a bit. I mean, it's still quite nice numbers, but it has dropped off over the last 2 sessions, I would say. So please do spread the word, and we'll also look at the distribution list and make sure that we've got the right people on the invite as well. But if there's anybody that you think should be attending who hasn't had an invite, just let us know.
And likewise, if you've joined today but you didn't get the invite directly, as always, please let us know so we can add you to the distribution list.
Yeah. Oh, somebody said Wednesday's the 3rd of June, not the 6th. So thank you for that, Janet. Oh. I'm assuming that you're right on that. But and that's true. It is indeed the 3rd of June. It's fortnightly.
Well done for spotting our obvious mistake. We're just checking that everybody was paying attention.
Yeah.
And please also, if you have any feedback about these sessions, as we said, please do feedback to us. These are for you, so anything that we can do to make it more relevant, please let us know.
Okay, lovely. And feedback about the resources as well, if that's something that's helpful to you. Okay, so thanks everyone. Lovely as ever to be part of something with you all, and thank you so much for all the great work you're doing out there, and we'll see you next time. Okay, bye.
See you on the 3rd of June. Bye. Thank you.
Bye.